Yo soy de las personas de que tengo que estar enfermo para dejar de trabajar. Sencillamente porque yo amo mi profesión.
Oh yeah. You should have good fundamental oral surgery
Yeah.
skill.
Yeah, at least the basics.
You have to know
How to flap.
how to flap or
How to
tissue
suture.
management or how to suture. That's
You have to
crucial.
International students, when you come to the United States, you have to have a goal first. You have to understand that you can do it.
There is no age, there is no dreams that you cannot make it true.
It's never late, man. It's just wanting to change.
Hello guys, another chapter of Romani podcast, A Face Behind a Smile. Creo que es we're doing a mini podcast with my friends, my brothers, Dr. Jose, Dr. Keenan, Dr. Frankie. Frankie, like you know, I did a podcast with him and I just met him, but he's a very strong guy, very good friend. My other friends is like a brothers. I know them from ever. I'm gonna ask them to present themselves. Dr. Jose, preséntate tú mismo. Dr. Kina, present yourself.
Of course.
You first.
Jose.
I'm the honor, I have the honor. So, yo soy el doctor José Manuel López, radico en el estado de Florida, en Miami específicamente, y bueno, tuve la oportunidad de conocer a estos doctores que la vida me puso en el camino, gracias a Dios. Hace, digamos que un par de años, un poco más de un par de años, al
Creo
doctor
que
Keenan,
casi 3 años.
sí, al doctor Romani, y también acá nuestro gran colega, el doctor Frankie
Y
Castillo,
profesor.
y faculty además de LIT con el doctor Mungalo, que nos dieron la oportunidad de pasar una excelente semana allá en Guadalajara, México,
Así es.
y muy buena experiencia y muy buenas amistades que hicimos. De hecho, bueno, en menos de un mes enos acá, de nuevo compartiendo un poquito de tiempo acá con nuestros colegas de New Jersey.
Así es.
Dr. Tawil, present yourself.
I'm Dr. Keenan Tawil. I'm part of this nice place up here. I have a pleasure actually to be with this week with Frankie, Dr. Frank. He has a very good experience actually. We learned from him a lot, and it was a pleasure to see my brother Jose again here in New Jersey actually.
So guys, today we're gonna speak. We're gonna talk about experience about dentistry. It's gonna be kind of, I don't know, it's gonna be kind of boring, but like I always say, este podcast no está dedicado a hacer dinero. Este podcast está dedicado a aquella gente que me estás viendo para que sepan que sí se puede hacer. Son 4 historias diferentes, pero llegamos al mismo punto. Somos profesionales. En algún momento dijimos no se puede, pero continuamos y lo hicimos. Cada uno de nosotros va a hablar de aquello que te interesa saber, te interesa empujar. Estás pensando ahí sentado tú viéndome o escuchándome diciendo quizás no, es muy difícil, todos tuvimos nuestras barreras, pero lo hicimos. Dr. Tawil, it was difficult to be a dentist here in United States.
Yeah, of course, as we said before, it was an easy
And
process.
you are Dr. Tawil is from he's Arab, he's from Syria, and it was kind of difficult.
Of course, it was the whole entire process was difficult. Dr. Lopez, he knows even better than me about the process.
Mm-hmm.
It wasn't that easy, right?
Yep.
We have to go through a lot.
Yeah.
At the beginning, but thanks, we are grateful for God to be here. International students, everybody has to know this thing. When you come to the United States, you have to have a goal first. You have to understand that you can do it. It will be difficult at the beginning, but you can handle it. The only thing, you have to have a plan.
I think you have to trust in yourself.
And you have to trust yourself, and you have to reach out to people with experience who pass through the entire process. That will be literally helpful in getting the job done right.
Yeah. Like in some point, Dr. Tawil, so everybody that knows me and knows Dr. Will, we work here in the East Coast. We're doing like big things. We just have a surgery. Dr. Will is like, I don't do anything without him. He's my brother. He's a sweetheart. But Dr. Will has a different experience than everybody. So every people here sitting here, we have different experience. We're sitting here as a doctor, but we start 3 years ago. If you go back 3 years ago, we've been thinking about being doctor here, and now we're doing like another life.
Of course, we walk the mile actually, but as we say, that doesn't come from nowhere.
Of course, you have to try
Constant
yourself.
training and reaching out to people with experience, learning from people with very good experience as well from our colleagues like Jose.
So it was difficult to be a dentist here.
What you were doing? It wasn't easy.
What you were doing before being a dentist?
I was a dentist. I was a dentist
So
back
how
home.
how long were you in practice back home in Syria?
Yeah, since 2012.
2000. Oh yeah, okay. So we graduated the same.
Yeah, 2012 till I got here to Rutgers. So I practiced for a good couple years over there.
Now,
Carried the
when
experience
you
overseas, yeah.
when you were applying to Rutgers, this might be actually something that might be intriguing or interesting to a lot of international doctors. Did you have to present an actual placement or practical exam, a placement test? Did you have to do like?
Of course. yeah.
Okay, so what did Rutgers require of you as an IDP student?
As an IDB student, there's like a general requirement all over the country. Actually.
All of them,
Yeah,
yeah.
all of them. But mainly, you have to have the National Dental Board examination.
Good. Did they want just part one and part?
You-
Well, now it's a
back in the
combined.
days,
Now
you
it's
used to
not.
have-
But back then.
Yeah.
At that time was part 1, part 2.
Oh,
Part
did
two.
you need to have both to get in?
Yeah, at that
Oh,
time,
okay.
yes.
Because some
And then the TOEFL
universities,
score,
oh, that's right. You had to do TOEFL too.
because we're international.
It was
Yes.
the worst part of this process, the TOEFL.
I mean, listen, I
Freaking
knew that at some
TOEFL,
point I
man.
want to do more boards or dental boards than the TOEFL itself.
Yeah.
Because it was so difficult. At least for me, it was a very hard time to get like a right score to apply for the university.
I've heard a lot of mixed reviews about that. A lot of doctors say that the TOEFL was a nightmare. Then there's other doctors that say that wasn't too bad. Like, it's hit or miss. But I have heard
It's a
that
very technique exam.
okay.
It's not how is your English, how fluent or how good is your English, technically speaking, but you have to know how to get the exam, how to take the exam.
Right.
It's a
Because
strategy.
it's
Of
very
course, of course.
sensitive.
Yeah.
I think they
And the
measure
technique.
if you can communicate in English.
Hmm.
Yeah.
I don't even know how to communicate in English still. But my TOEFL was enough to go to university. I don't know how I can. So, but listen, don't think about
That was
it.
tough. That was tough.
Just do it, man.
That was really tough.
Just jump.
That's right. I mean, that's how we all made it here, really.
Yeah.
I think we have no other option than
And
Just taking the
I'm the
exams.
youngest from this group. 35. No, I'm just kidding.
32.
I mean, there is no age. There is no dreams that you cannot make it true.
It's never late, man. It's never late.
It's never late.
It's just wanting to change. If
Of
you want
course.
that change for your life,
Did
Run with
your
it.
life change?
Of course, drastically.
So it was worth it.
It was definitely worth it. It's worth every little minute that we spent studying, and
Yep.
definitely worth every little minute.
So guys, that was Dr. Will, Dr. K, right?
Dr. T.
Dr. T, Dr. T. So now I will present this guy to my in my right. He's Cuban. He's amazing clinician. This guy is a monster. He's over there in Miami. Hopefully, because if he's not, I'm not gonna have patience. But
he's a vampire is what he is. He's a vampire. At the course when I met him, this guy's literally walking with like handfuls of like
Blood.
vials, just taking blood from all the patients, just do PRFs,
Yeah.
and he's getting like 10 membranes
He's
in
a
there. And I'm
PRF
like,
expert. Yeah.
oh yeah, he's a
He
monster.
has
We
his
call
own
him a
way to do
vampire.
birth, yeah.
So
Yeah.
this guy is a monster. He's an amazing clinician. Dr. Jose, present yourself.
Okay, so Yes, I started my first time down at school in Cuba. I finished in 2007, and then I had the opportunity to go out of the country because Cuba is like a very complex country in any way you
It's a
can see.
difficult country.
Yeah, and well, I went to Venezuela and I worked based on a contract between countries for like a year.
In
Max.
Venezuela?
Yeah, in Venezuela. Yeah, like a year max. Then I went
Most of
out of
most of the Cubans they went
It's
to
easy to go
That's-
to Venezuela.
I did not
and
know
other
that.
countries.
That's actually interesting. Okay.
So, cuando Chávez era presidente de Venezuela,
Mhm.
hizo varios convenios con el gobierno cubano. Y entonces a través de esos convenios, profesionales de la salud comenzaron a viajar a Venezuela en contratos entre gobiernos, ¿ves? Entonces, en todo Venezuela. Entonces, a partir de ahí...
So where did you go? Where in Venezuela?
Well, yo llegué a Falcón, en Venezuela, al
Okay.
estado de Falcón, por el tiempo ese que estuve trabajando dentro del contrato entre gobiernos. Luego, I just went by myself, so, out of the contract. No recuerdo bien cómo es que se llama la palabra que ellos usan. En español se llama de sector,
Okay.
¿sabes? Que como que te vas por tu cuenta de la misión
Ajá.
y abandonas la misión, ¿no? Eso fue lo que yo hice literalmente y tuve la oportunidad de conocer colegas allá en Venezuela, con los que tuve buenas relaciones, buenas conexiones en el mundo nuestro dental y me mantuve en el mundo nuestro y aprendí mucho, o aprendí muchas cosas que no tuve la posibilidad debido a la falta, digamos, de recursos, de materiales, tecnología que tenemos en Cuba, desgraciadamente. Y ahí me puse un poquito que más, I update myself in the dentistry field, you know. Y empecé a hacer otros procedimientos, empecé a hacer otros procedimientos desde el punto de vista quirúrgico que me ayudaron como que a buscar y a tener un poquito más de experiencia hasta que, bueno, llegué acá, tuve la oportunidad de llegar acá y empezar todo este proceso nuevamente, de cero, básicamente, porque yo sentía y siento y me parece que sentiré toda mi vida, digo, le digo incluso a las personas que me conocen que muchas personas no lo piensan así, yo respeto todos los criterios, pero yo soy de las personas de que tengo que estar enfermo para dejar de trabajar. Digamos porque no sé, sencillamente porque yo amo mi profesión.
Oh, yeah.
O sea, yo más allá de la finanza, más allá de la economía, más allá de lo que nos pueda enriquecer por una parte u otra, ya sea desde el punto de vista humano o no, la profesión nuestra es bastante complicada y compleja en todos los sentidos.
Estresante.
Y muy estresante. De hecho, uno de los datos importantes que es creo que la segunda profesión en US de más suicidio.
I think it's first, actually. Isn't it?
Lawyers
Attorneys
and dentists.
and dentists, yeah, have the highest suicide
Yeah, have
rate.
the highest suicide.
I didn't know that.
Oh, yeah.
Yeah.
Oh, yeah, bro.
Yeah,
We have the highest suicide rate.
US score. Sí, ellos están en la...
Are you think about that?
Welcome. Did you know that?
Lately, actually. I started.
Oh, no.
I was saying
Yeah,
about
you
the
see?
rate.
He's talking about the statistic.
yeah.
I was talking about statistics.
So I don't know anything about this.
Any
No,
it's
doctor
true.
that wants to treat
It's
the
true.
doctor
It
will,
is.
please.
It's true.
But do you know why that? You know why that exists? You see,
Because
okay,
you do too much for
so
life,
in
man.
dental schools, they focus on dentistry as a career.
Yep.
But they don't show you,
As
they don't
business.
teach, exactly. There's a whole business logistic to this. These are small, a private practice is a business. Now,
Of course.
it could be on a small scale or on a large scale.
Yep.
But a lot of that entails management, which is employees, human resources. You're dealing with insurances. You're dealing with patients. You're dealing with overhead. And all of that, patients don't care about that. They don't even know that exists. That's like a whole other world for them. And they simply, they're not interested in that. They want what they want, and they want the treatment, and they want to receive the best, right? But they don't see the behind the scenes and all the pressure that many times a dental professional is actually exposed to. They have all this weight on their shoulders, and sometimes they can't handle the pressure.
Of course, that's
Also, depending on certain scopes of dentistry, if, for example, we all met through surgery, surgery has a lot of high risk.
Mhm.
It's high risk
Definitely.
treatment, high risk, high reward, right?
Yep.
But because of that, you're also prone to legality issues,
Yeah.
and in the field of dentistry, patients forget sometimes that we're human too.
Yep.
We have feelings.
We make mistakes.
We make mistakes, but aside from that, we also have a personal life too
Yeah.
that we have to put aside when you walk through that door of your office.
Sorry.
You have to come in and you have to perform, and you have to put all your emotions aside. And then sometimes when you go home, you can't handle the pressure.
But nobody's able to do that.
I mean,
Everybody's not. It's not.
that's
able
why
to
we
do
have the
that.
highest rate.
It's
That's the
difficult.
point.
It's
That's the point.
difficult. It's difficult to imagine what we have to been through during the day, and the only person that eats everything is your company, your wife or your
Yeah,
girlfriend,
partner,
whatever.
Because
Because you get home and you don't wanna do you don't wanna do anything. You just wanna be like calm.
Your home should be your
Chill.
peace, you
Yes.
know, your moment of zen.
Yep.
Because the office is, even if it's a good day, it's still hectic.
It's hectic, it's stressful, but anyway, everybody here we love what we're doing. Like
Absolutely.
I'm telling you guys, I mean, if you love what you're doing, if you are consistent, more than discipline, I feel like consistent is better than discipline because you you can be disciplined in your life, but you're not consistent. Your discipline goes to the hole.
It goes hand in hand.
Yeah.
Consistency and discipline go hand in hand.
It's a balance.
Like apply it to like working out. You need discipline and consistency to get the result. Like it has to be. It's almost
They go parallel.
yeah. It's almost like synonymous. You know. Yeah.
Okay.
Very good point.
So guys, so you heard Dr. Keenan, Dr. Tawil history, Dr. Jose history. You know, we are doing like different realities. My reality, you know, already. I'm not gonna talk about my reality. And we just have yesterday another podcast with Dr. Frankie. I call you Frankie, right?
Yeah, that's fine. Yeah, that's me.
Not
That's me.
Mikey.
No, Mikey.
No, my.
No, please.
Yeah.
Please. Please. I remember.
He was
I
calling
don't
me
know. I
Mikey
always
all
call
week.
this guy Mikey. I don't know. You look like Mikey.
And I
I mean,
said, hey, just call me Mikey. I'm
I
fine.
just hear the whole week in Mexico like Mikey. It's
Hey,
no Mikey.
como
hey,
venga,
it's
bro.
Frankie. that was the whole
I was
week.
Mikey for the week.
I think that the last day that we just go
Yeah.
to the airport, he just said Frankie first time in the week.
Anyway,
funny.
it's a Dr. Frank. He's another whole reality.
Well, we all met through
Yes.
surgery. You know,
Mhm.
we all met
We are
through.
sitting here with the same reality. You go next week, you go see patients. I just saw patients. He goes tomorrow, he goes see patients.
Yeah, no breaks, bro.
And we are extremely good clinicians.
Absolutely. I think we all carry good caliber. We all have certain fortes.
Yeah.
Okay, and I think that's kind of what makes us very dynamic. If you noticed, you knocked out a full arch in an hour.
Mm-hmm.
An hour. Like, come on. That workflow it comes from repetition. I said that yesterday. Repetition, practice.
Consistent,
Practice makes it better.
discipline. I mean, you have to love what you're doing.
That's why it's funny whenever we talk to fellow colleagues all the time. You never tell a fellow colleague like how's your office or how's your clinic. You always say, hey,
How's your
where's your
practice?
practice? How's your practice? Why? Because that's what we do every day.
We practice, yeah.
We practice.
Mhm.
And that's I see it with my father. Over the years, he's been practicing for over 50 years.
Oh.
So 54, I think. So now there's nothing he hasn't seen after 50 plus years.
Of course.
It's experience, and that's how you get good in anything. And you're able to execute like an arch today with such efficiency. It's because we're constantly practicing. It's ever evolving. You have to continue to just keep growing in specific branch.
And learning as well.
Absolutely.
Yeah, 100%. So that's why I consider that we always need to keep doing like a research or continuing education courses, like Mexico courses, something like that, just to learn from other people.
You
Something
always-
that you
always
never
learn.
probably hear about it or never saw it before. So I think that even though you think that you are good, still progressing in your professional life
This career,
from others.
it
you know?
requires it.
Yeah,
This
from
career
others.
requires.
And don't get stuck. Yeah.
Especially now with technology, I mean, you better be in top of it. If it's not, I mean, it's like when computers comes, right? If you don't know about computers, I mean, come on, you are like done there,
Outdated,
update.
obsolete.
So that's why we were talking yesterday about it. I have nothing against to freehand, implant placement, but why you want to get or take the risk if you can do it, guided or full guided in the way that you can avoid or minimize any kind of risks.
This is a good topic
Because
this is a good topic because this guy is the monster of the freehand.
Okay.
No, I mean no.
No, I think it's good.
No,
I like-
I like it. I love it. That's the ABC. That's the ABC, because people in our countries
Yes.
don't have the technology or the resources to do like we did right an hour ago, like full guided.
Listen,
So
I mean,
and the ABC is that the ABC is completely free-handed.
guys, in my office we do it fully guided. Fully guided means for whatever is there. Fully guided means you come to my office, I take the CBCT, I take the intraoral scanner, and I fabricate myself a surgical guide. It gives me the exact direction for the implant. So I will place your implant in 20 minutes.
Okay.
Maybe 20 minutes. But people like Dr. Frankie, you too, man.
That's why I'm talking the same
Dr. Jose,
point.
Dr. Kina,
Because we do freehand
they,
as well.
they do free-handed too. It means free-handed means that you don't need nothing. You just open the flap and just expose the ball, and then you put the implant wherever you think and you feel is good, right? Always having consideration anatomic structures, right?
And restoration.
But I don't take the risk.
So
I'm not that good.
when I got into when I got into guides, one of my colleagues, a good friend of mine, Dr. Casey, he's over in the Stockton area in California. He actually got me into guides, and realistically, he kind of showed me how to do the planning. Oh, this was a few years back, and then I got into planning with software. And realistically, if I do use a guide, I only use the guide for my pilot drill. If I use a guide, just for the pilot. After that, that guide goes out the door, because that's literally what he had told me, and I'm like, that makes sense. After that, it's freehand. Now, sometimes I don't even use a guide. I already planned the case. I studied the case so well. I go into the case, and I just know what I'm going to do.
But there is nothing wrong with using a guide.
No, not at all.
No,
Well,
it's just another
Probably time consuming.
the only thing
not even because you come to my office, you come for a consult, for an implant consult, you need an implant. I will say, okay, I will give you the implant. Just another appointment you come, right? I will place your implant.
Now the question is this.
That's the time consuming
The-
point. Sorry.
the
because
question is this.
At that point, Frankie can do it right away and don't wait for a second appointment. If you want to place the implant right away and the patient want it.
Okay, but
Or-
what about if you are without that tooth for 10 years? Do you think he will care to wait 2 more days?
No, I don't think there's anything wrong with either or. My question is this. This is why with a lot of the students or a lot of the alumni that I work with, I always try to emphasize get good at freehand first before you get into guided.
course,
Because
yes.
my question to them is always, are guides perfect?
If you have any complication during that guided surgery, you might be able to correct it.
Right, but
Because you have
No,
you
there's
are
no such
exposed.
thing as a
I have
perfect.
experience in full cases of full arches. Sorry, that the guy get broken, and I had to continue, even with the broken guy, and I had to finish my case because everything is open already, and I'm in the middle of the surgery, so I'm not gonna stop or close or tell the patient, hey, we need to wait like an hour.
I gotta print a new guy.
Yeah, print a new guy or something like that.
Yeah,
And the
happened
lab,
to us,
and the
yeah.
lab's not right now, right here. So
Maybe happened once. Or
Well,
twice.
you know what does happen is
Yeah.
this. You can place a guide. There could be a possible deviation in the guide, or there could be maybe it wasn't seated correctly, and you overlooked anything can happen, right?
Yeah.
And if that does happen, what tends to happen when you place your implant, it's not in the ideal position that you originally wanted. And that's happened. That's happened to everybody. So, going back to the fundamentals of freehand is going to help you. It's not to say that guiding is great because it's efficient.
But it's the ABC.
Super efficient.
It's the ABC.
But it's always good to know how to do.
Yeah.
If I'm gonna
Freehand.
teach somebody, I want them to learn freehand first, and then I want them to get
Yeah,
into
me too.
guide.
Yeah.
That's the
I mean,
recommendation I would give.
I don't have nothing against freehanded. I think freehanded you have to do it because you have to know about technique, about what you're looking at. You know, you wanna go to implant world, you have to know how to handle situations.
Yeah.
Definitely.
Oh yeah.
And I think my best recommendation would be always update yourself. Always learn from everybody. Always get around people that knows more than you. So I always been like, I mean, all these guys here that you see, guys, they know a lot more than me, and I feel like
think so.
like for example yesterday we did a surgery. You teach me a lot, and I learn. You know, every time I do a surgery with this guy over there, I learn a lot because this guy have a different approach. This guy to my right I learned a lot too. We were like 1 week in Mexico, even though this guy sometimes is, my God, this guy is annoying, but he is a very good clinician. Very good clinician.
Shots fired. You guys did really well together, actually. You guys had a great dynamic. And I also saw how you two work together. You guys have a great dynamic, too.
Of course.
That's also very important, too, is who it is on your team. Like, the guys that I work with, I mean, man, I feel like I'm part of, like, some of the best guys on the planet.
Yeah.
And they make me want to excel and make me want to push, too. But having a good team and having that good synergy is super important. I think in the implant world, something that I wanted to add was to what you were saying. When anybody wants to get into implant dentistry, and I see this a lot in a lot of courses, is you should have good fundamental oral surgery skill.
Yeah. At least the basics.
You have to know
How to flap.
how to flap or
How to
tissue
suture.
management or how to suture. That's
You
crucial.
have to respect the anatomy.
You have to know your
Of
basic
course.
anatomy. You have to know anatomical landmarks and structures. But people think that exodontics or exodoncia, they think that's, extractions are easy. Extractions are not easy.
No, it's pulling a tooth.
You have no. Some teeth are. I mean, you got
course,
ankylos.
man.
There's complications, and I do a lot of oral surgery. Even now and before I got into implants, oral surgery is what leveled my game up, and it prepared me for implant dentistry. Now, some people, they come fresh out of dental school, and they just want to go straight into implants because they're thinking monetary compensation.
Yeah.
But realistically,
It's not like that.
oral surgery is also a very good there's a lot of monetary compensation in oral surgery also, but it's also a very articulate and meticulous skill.
Oral surgery gives
Always there is a fight, but it's not like a real fight. I mean, when I say fight, it's not the same. The
big-
real meaning of fight. In between, dentists, perio, and oral surgeons. So based on implant word or the implant field, yo me quito el sombrero con los especialistas, porque yo sé perfectamente que yo soy like a general practice dentist, lo que trato de limitar mi práctica a lo que es los procedimientos quirúrgicos como tal, cirugía oral. Pero no quiere decir de que estemos ni por encima ni por debajo. Yo me considero de que todos somos dentistas, porque para ser cirujano maxilofacial y para ser periodoncista, ortodoncista, primero pasamos por la carrera de la escuela dental, ¿verdad? Y tenemos que, digamos, mantener todos los conocimientos y los fundamentos de como tal un dentista general. Y bueno, después llevarlo a otro nivel, que es un nivel especialista. Y yo considero de que nosotros como dentistas generales no somos ni más ni menos, pero sí me quito el sombrero porque es un sacrificio extra para los especialistas llegar a ser ese especialista.
I agree with you. Can I add to that? I want to add to that. Actually, you're touching on a very good point. I remember one of my professors in dental school. He told me when I did my first extraction. My first extraction, man, I was a kid.
Do you remember
And
the first
oh
extraction?
man,
Oh,
it was a
man,
bicuspid. It was a maxillary bicuspid.
Mine
Okay.
was a first molar
Oh man, this
with
this
hypercementosis.
this was it was
yo.
brutal. Okay.
It was my brother.
Oh god, I was
You
working.
don't have to take care about it.
I was working for an oral surgeon at the time, and so I thought going into that department, I was maybe like in my third year. I thought going into that department that I was gonna do excellent, right? Y me toca un premolar, bro. Like, come on. Like I do those all day long now, you know. But back then, I couldn't do it, man. And my frustration was,
You got
I had to actually like. I caused a iatrogenia, you know, like I actually had to like, I blew out the buccal plate because I couldn't take the tooth out. And then when I left the clinic that day and I went outside, I was bummed out, man. And then the professor comes up to me and he says, look, he says, don't be so hard on yourself. You're trying to become a general dentist. You're trying to become a GP. That means you have to know how to do everything, generally speaking. What he was trying to tell me, and he actually made his point across to me, which is kind of to add what you're saying. I think the advantage of a GP is that you see things in all scopes of dentistry.
Yep.
Now, I talk to my colleagues that are oral surgeons. They're focused in oral surgery.
Yep.
You talk to a periodontist, they're heavily focused in tissue. You talk to a prosthodontist, they're heavily focused in prosthetics. But then you talk to a GP, they know pretty much a general consensus of everything. So you're looking at everything in different scopes of dentistry. Something that, I'm not saying all specialists don't do, but some specialists, they probably don't see things. An oral surgeon may not be thinking as a prosthetic dentist.
Yeah.
Now, I have another mentor of mine. He's a prosto. He's a pros guy. Every time he does his surgeries,
He's thinking about
thinking about prosthetics. And that's what makes his execution really well. Okay, he's not an oral surgeon, but he does surgery thinking about the prosthetics.
Yeah.
And I like that.
I have to say something very I think it's interesting because I found it and I wrote it because I know this is gonna come. So it says like this, right? Mistakes are painful when they happen, but years later, a collection of mistakes is what called experience.
That's true. That's true. There's a saying in Spanish, uno aprende echando a perder.
Exactly.
Exactamente.
I'm trying to translate that. It's basically saying that, and I know you understand it too, but for those that don't, it basically means you learn from mistakes.
You still saying in English. So
Yeah,
what you
but
want to translate? Translate in
Translate in like
No,
literally.
lo
it's
dije en
different.
español.
You say Brendy, right?
Spanish. No, you say
No,
it in
last time
English.
I did?
Yes.
Uno aprende echando a perder, bro.
Ahí sí está en español.
Yeah.
So vamos a hacer algo curioso, okay? So this is your experience doing your first extraction, kind of your first extraction, right? My first extraction, I was like 21 years old. I was by myself in my office. At that time, it was my girlfriend's birthday. They were waiting for me, right?
I
And
know
this guy comes,
I know that.
very tall guy. I say it was a premolar. I say, okay, come. You wanna laugh? So I couldn't do it. Premolar. I traumatized with premolars.
Maxillary or mandibular?
Maxillar. You know what I did?
The same
You
one.
know what I did?
What'd you do?
Yo, you wanna laugh? So I couldn't do it. And in front of me was another dental office. I knocked at the doctor and said, please help me out. So this guy comes and he took it out. I mean, but it's experience.
Are you...
Now, every time I see a tall guy, I say, let me take an X-ray.
Now,
But,
when,
you know.
when you got into doing oral surgery, were you an elevator guy or were you a forcep guy?
Elevator guy.
More elevator. So, sabes que
Okay.
En Cuba tenemos la posibilidad, a pesar de tener pocos recursos y casi nada de tecnología, en la parte quirúrgica, sabes que la parte quirúrgica más que todo lleva un poquito de instrumental, no lleva, digamos que, tantas complicaciones como tantos materiales y cosas así, ¿verdad? Entonces, gracias a Dios, en Cuba, la parte de la formación esta de cirugía oral en cuanto a extracciones,
You have a lot.
nosotros tenemos cierta posibilidad, oportunidad de tener bastante práctica, digámoslo así, desde que somos estudiantes. Y desde que somos estudiantes, de hecho, si estás interesado, también tienes la posibilidad de entrar a salones mayores, a quirófanos y cosas así que por la misma situación, y si te gusta, aún más, tú tienes el conecto ese con los mismos profesores y te entras con los mismos profesores y ahí vas aprendiendo y tú sabes, y como que te vas abriendo camino, o te vas soltando, o vas perdiendo como ese miedo, no sé cómo decirte, pero vas como que dejando esa timidez y vas como que abriéndote camino. Y si te va gustando a medida que vas avanzando, aún más, ¿me entiendes? Y entonces, como que yo hasta cierto punto fui bastante fresco en lo que fue mi experiencia como estudiante en la carrera en Cuba. Y fui bastante fresco porque me empezó a gustar ese mundo de la cirugía. Y entonces tuve, gracias a Dios, muy buenos profesores
Good mentors.
que sí me ayudaron un mundo. Y de esos profesores que te enseñan incluso la última carta que tienen bajo la manga. Eso que no viene en los libros, eso que a ellos les costó tantos años llegar a ese...
Tips.
Mañas.
Exactamente.
That's what you learn. Tips.
Exactamente,
Mañas.
esas mañas, esas cosas que te ayudan para toda la vida, ¿me entiendes? Y tuve muy buenos profesores. Y independiente de profesores, tengo y me imagino que tendré por el resto de la vida muy buenos colegas que son cirujanos maxilofaciales desde Cuba. Algunos se hicieron incluso maxilofaciales acá en Estados Unidos.
Wow.
Otros,
That's a big league.
sí,
That's cool, man.
That's big leagues.
Bueno, tengo el caso del doctor Juan Carlos Lazo, que es un doctor cubano que está en Miami. Tengo el caso que, bueno, este caso es bien particular porque él se hizo cirujano maxilofacial en Cuba, luego él y la esposa se fueron a Letonia porque él es como Tania, que es mitad y mitad. Y entonces se fueron a Letonia, hicieron su cirugía máxima también en Letonia, se hicieron especialistas en implantología en Letonia.
Wow.
Y después llegaron acá y se hicieron dentistas generales acá, pero después de haber hecho ya cuántas cosas de maxilofacial y de implantología no han hecho en más de 10 años o más de 15 años de experiencia como especialista. Para mí, este doctor es para mí como mi hermano, el doctor Lina Gelbe. Para mí es como mi hermano y todos los días que conversamos, que tenemos la oportunidad de conversar y compartir, siempre aprendo algo y lo aplico si puedo, el siguiente día, si tengo el caso, lo aplico. Y me resulta bien, me resulta positivo. Y lo mantengo. Sin contar, y bueno, ustedes sí lo conocen, el doctor Leste Gil, que para mí es hombre, amigo, familia, es una persona espectacular, de las que tú conoces probablemente en la vida, no más de 5 en la vida, y siguen ahí constantemente. Ese para mí es como el doctor Mongalo Portillo. Es uno de mis mentores que gracias a él hoy yo creo que hago lo que hago y trato de mejorarlo poco a poco. Eso mismo de PRF que estábamos hablando. Este doctor es
He's another vampire.
out of the league.
So, si tendrías que decirme solamente una persona, profesionalmente hablando, that you admire.
Doctor Gil. Right now,
I'd have to say
You have to say one.
Pop.
Pop,
It
yeah.
can only be
In
one.
your case,
Just one.
It'd have to be my pops, man.
yeah.
My
Yeah.
parents, yeah.
Actually,
Don't say Delphine, please.
I was about to say Delphine.
Don't say Delphine.
Are you a first generation dentist?
I'm a first generation.
Are you all
dentist.
first generation?
We are,
I'm a first generation.
except for you.
Yeah,
Oh,
I mean,
okay.
definitely there's a lot of professional people that's passed in our life,
But-
especially when we're in
You know,
school.
you know my experience. talking about first generation dentistry. Mi hermana es doctora ortopédica. Mi hermana es mayor que yo. Pero yo desde niño, pánico, terror a las agujas.
Man, everybody in Cuba is doctor, man.
No, va, porque es una, pero
But it's good. They're super intelligent, man.
or sport player.
Oh, yeah.
Or
That's right.
or they-
Baseball.
Baseball
yeah.
player.
or salsa
Boxing.
dance.
Pero no,
But, man,
esto es una experiencia particular.
doctors. Oh, yeah.
Very
que,
good doctors.
I'm scared about needles since child, you know. Que tenían que correr los doctores atrás de mí y aguantarme para que me pudieran sacar sangre. Y cuando yo termino mi high school, que estoy en el proceso de ver qué carrera voy a optar y nada, hago mis exámenes de ingreso y me dan dentista, ¿sabes? Me dan la carrera dental, de la escuela dental. Llego a la casa súper emocionado porque me habían dado una de las carreras más codiciadas en todo el país,
Yeah.
que aquello no era para todo el mundo, no todo el mundo clasificaba, digamos, en ese tipo de carrera. Y le digo a mi mamá, me dieron estomatología. Y dice, sí, bueno, en Cuba es estomatología.
En Perú también.
En Perú también.
Yeah.
Y porque en Europa es odontología, en España, por ejemplo, es odontología.
Odontología.
Y entonces me dice mi mamá, pero estomatología, pero si tú le tienes terror a las agujas y a que te saquen sangre, ¿de qué tú me estás hablando? Dígole, bueno, a que me saquen la mía, pero a que yo saque la de otro, no creo que
I
vaya
think I'm the
que vaya
same.
mucha diferencia.
Listen, si tienen que sacarme sangre, it has to
We're
be
not good
too bad.
patients.
No.
We're not good
No,
patients.
man,
Listen,
no,
listen,
no,
listen,
listen. I mean,
this is a
for
true
me,
history.
no,
This is a true
no
history.
needles.
I'm a
This is
little
true
nana
history.
too, man. I don't like that.
This is a true history. First time I met this guy in IDP. Remember that?
Yeah, of course, we went to blood.
And I had to go with him
To draw blood or what?
to a drop
Yes,
blood.
man. I mean, when
Because
I
he
see
gets
that
so
freaking
nervous.
needle coming with you, it's like
I
I'm
don't-
about to pass out.
I don't like that either. I don't.
Listen, that was. I mean, I cannot tell you. That was like, do you want my hand?
Hold me. No, I'm personally I'm the same way.
No,
Like
it's
I
crazy.
don't like
You like needles?
I don't like that.
I mean, of course, I don't like them to get through me. I like.
Ironically, that's the reality. You know what's crazy is sometimes we're so focused as you know
Clinician.
practitioners that we're so focused on our own patients that we sometimes neglect ourselves.
Of course,
One,
yeah. Mhm.
and
Yeah.
two, we also
forget
the
to take care
the
of
patients don't see us as patients either.
Yeah.
My patients never assume that
That's
we're
why
on the
in
chair.
Yeah,
Yeah.
of course.
They always think we're sitting on this side of the chair,
And we are patient too.
but we're
Of
patients
course,
too.
we are humans. We
We're
patients.
human beings, man.
Yeah, we get cleanings,
Well, I mean-
we get fillings.
No, y por otra parte, acerca de sensibilizarnos. Yo hasta cierto punto soy una persona que siempre, a pesar de que soy doctor en este caso, o somos, yo siempre me sensibilizo con el paciente en todos los sentidos porque yo sé que lo que le está pasando a mí me pasa también. Y yo no quiero para el paciente lo que no quiero para mí.
Por supuesto.
¿Me entiendes?
Yo creo que
Empathy.
yo creo
Empathy.
Exacto. Entonces, eso que tienes que anestesiar. En ciertos casos duele.
Yeah,
molesta.
duele a cierto
¿Me
Sí.
entiendes?
punto.
Entonces, yo trato de como que reducir o evitar o minimizar al máximo ese tipo de molestia o de mala experiencia o de, tú sabes, trago amargo para el paciente, de dolor. Porque yo como paciente también, a mí no me gusta.
Ujú.
¿Me entiendes?
¿Quién le gusta tener la boca abierta?
Pero hay. De hecho, llegar al dentista y sentarte en una silla dental
Es traumatizante.
es traumático.
Oh, ay, decime qué paciente llega a la clínica feliz.
No.
Nobody.
No existe.
Everybody comes in like, oh, you know, it's their first time. They're nervous.
Yeah, no,
They're looking
existe.
around. They hear all these noises.
Es bien complicado.
You know, like
es bien complicado.
they feel the vibe, and most of the time, patients
complicado.
don't. They're not in a comfort zone when they
Yeah,
come to an
definitely.
office,
At all.
yeah, especially in surgery. Are you kidding me?
So
No,
guys,
we are the enemies. At that point, we are the enemies.
I swear to my guys that this podcast is gonna be like 20 minutes. I told you yesterday we're gonna speak about dentistry. We can
We
can
go
be
all
here
day.
like 2 hours, man.
I think
Easy.
we have an implant consultation waiting.
I have a couple questions waiting for me, but I mean, the only reason that we're doing this podcast with this kind of people, amazing clinicians, different historias, es porque, again, I want you to, like, que estás viéndome en este momento, que creas en ti. So, cree en ti, repetición, para mí, mayor que disciplina es constancia. So, sé constante en lo que tú quieres. Como siempre digo, desayuna, almuerza y cena con la idea que tienes. Da gracias a Dios que estás vivo, que tienes salud y lo vas a poder lograr.
Y sobre todo para los dentistas internacionales como nosotros, que sí es posible. Es difícil, el camino puede ser largo,
Es muy difícil.
puede haber muchos obstáculos en el camino,
Pero
siempre piensa que si personas como nosotros lo han podido lograr, nosotros también lo podemos lograr.
One advice for the people that is looking at you.
Of course, as Jose said, nothing is impossible.
Yeah.
Is you have to have the persistence and the discipline, and you have to have a plan, and you have to, always look for people who has experienced this before, because you can't shortcut the way.
Don't be the
Don't be afraid.
If you are,
Be afraid to be
try
scared.
to be with people that is more experienced than you.
Of course.
Like we were talking yesterday, if you are with 4 clowns, you're gonna be the 5th.
Yeah, of course.
Quinto payaso, bro.
Y
Quinto
no eso,
payaso.
te estoy hablando de personas que incluso, colegas nuestros, está el doctor Joel Santiago, que con 2 hijos pequeños logró hacer lo que hemos hecho nosotros.
This guy.
Acá el
Dios mío.
doctor Quinan, que también con una criatura pequeña, prácticamente recién nacido, que estaba el niño
Sí,
cuando lo
el niño
conocimos,
cuando-
¿verdad?
sí.
También lograste hacer tu cuestión y aquí estás también y lo lograste. Hay cosas que es sacrificio.
Mhm.
El sacrificio es establecer prioridades.
Depende
diría yo,
mucho de la persona que está
y
vive a tu lado.
de ser, independientemente que puedas o no, puedes ser una persona soltera o no, pero no es el punto es proponértelo y ser constante, ser disciplinado, como estábamos hablando, y ser consciente de que sí, que es difícil, pero que imposible no es, honestamente
It's not
imposible no es,
impossible.
a cualquier edad, porque le das un número nada más.
¿Algún consejo? Really quick.
Leadership. I think strive to be a leader, and a leader doesn't necessarily mean create or look for followers.
Ujú.
A leader creates other leaders. That's why I love to teach, because I like to empower you guys, I like to empower other doctors, and I like to uplift myself and uplift my team with me. Be a leader and put your faith in the Almighty, and everything should fall in place.
Just one advice.
Just one advice, keep going, let's do it. So, no sé si ibas a comentar algo acerca de, ¿no?
I did.
So I would
Ah,
say
you did it?
Consta
Okay.
DDS,
Yeah.
Dr. Keenan Tawil, Dr. Jose Comesanas, Dr. Romani, Lucas, Instagram, Facebook, and this guy is gonna do a raffle.
We're going to do a giveaway. We're on our 3rd giveaway, so we'll be giving this full elevator luxator kit. You guys already use this a lot over
it's
there
very,
in Mexico.
It's a very good.
We're going to go ahead and raffle this off. I'm going to collaborate with
It's gonna
Dr.
be a-
Romani,
Yeah.
and we're going to collaborate, and we're going to basically give this away at no charge. So
It's
all
a-
you got to
it's-
do...
It's gonna be available in CVS, Walgreens. If you wanna take a tooth out, you just buy it and no.
It's an
Wow.
excellent kit, guys.
Follow the description. All the information will be there. And
Sin
those
dejar
that
de
want to get in
mencionar-
it,
Sin dejar de mencionar, ya un segundo, saludar a todos los colegas que tenemos en Guadalajara, México, saludar a todos los colegas que tenemos en Miami, Florida, acá en New Jersey, en New York,
Cali.
que casualmente hoy está cumpliendo años un gran colega nuestro, el doctor Brian, y esperemos verlo luego
Brian
más tarde.
cumpleaños hace 2 días.
Sí, pero bueno, vamos a cenar hoy con él a modo de celebración de su cumpleaños y esperemos que la pasemos bien. Super. So,
Guys, thank you for watching and look these guys up.